Fantastic, thank you. Okay, Heather, could you start the live stream, please? I've had confirmation that live stream has started, Chairman.
Great, thank you very much indeed, Leanne. Let me find my papers. So, good morning, everybody. Welcome to this virtual meeting of Cornwall Council's Health and Wellbeing Board. So, before consideration of today's business, I'll outline the protocols for the meeting. So, today's meeting is being live streamed to the public via Microsoft Teams and is also being recorded. If the Council's live stream fails during the meeting and we cannot share the proceedings, I will adjourn the meeting so that access can be restored. If the issue cannot be resolved, I will halt the meeting and the remaining business will be concluded at a future date. If a board member experiences a technical issue, I will adjourn for a short period to try to re-establish their connection. When board members are speaking, they may choose to use their video. As I call board members to speak, I will remind you to switch on your microphone, and if for some reason you cannot be heard, the Democratic and Governance Officer will advise you. Votes will be taken by a roll call of committee members carried out by the Democratic and Governance Officer. Where a board member has declared a non-registrable interest, a disclosable pecuniary interest, or an interest by virtue of any trade union membership in a matter, they must leave the virtual meeting. Their departure will be confirmed and they will be invited to rejoin the meeting at the appropriate time. To confirm the procedure for today's meeting is that board members who wish to speak on an item should indicate by typing an X in the chat box. So if we can please just leave the chat box for indications of speaking and not use it for general conversation, that would be really helpful. Thank you very much, board members. So before we start today's business, I'll ask the Democratic and Governance Officer to confirm board members and officers that are in attendance. Thank you, Leanne.
Thank you, Chairman. Board members, I'll read out your name. If you could confirm the organisation or position that you're representing today, so that will just allow the public to know who's in the virtual meeting. I'll begin. Councillor Adam Painter.
Thank you, Leanne. Councillor Adam Painter, Deputy Leader, Cornwall Council.
Thank you. Dr. Paul Cook.
Thank you. I'm the new chair at NHS Kerno.
Thank you. Councillor Rob Rothshaw.
Good morning, Councillor Rob Rothshaw, Cabinet Member for Adult Social Care.
Thank you. Councillor Sally Hawkin.
Good morning, Sally Hawkin, Lead Member for Children, Public Health and Wellbeing.
Thank you. Councillor Mike Thomas.
Councillor Mike Thomas, Member for Helston North and Member of Public Health and Wellbeing Board.
Thank you. Councillor Cornelius Olivier.
Hello, yes, I'm the Cornwall Councillor for Penzance Central, and I'm on the board in that capacity.
Thank you. Rachel Wigglesworth.
Hello, I'm Director of Public Health for Cornwall and the Isles of Scilly.
Thank you. Natalie Jones.
Hello, I'm Natalie Jones. I'm Chief Nursing Officer for the CCG and here today for Helen Charlesworth May.
Thank you. Meredith Teasdale.
Hello, I'm Meredith Teasdale. I'm Strategic Director for Children's Schools and Families for Together for Families at Cornwall Council.
Thank you. Suzanne Wixie.
Cornwall Council, Director of Adult Social Care.
Thank you. Chris Blong.
Late Member Vice Chair, NHS Kerno Clinical Commissioning Group.
Thank you, Chris. Miles Topham.
Miles Topham, Chief Inspector Devon and Cornwall Police, representing Chief Superintendent Pierce.
Thank you. Helen Boardman.
Helen Boardman, Chief Exec of Cornwall Voluntary Sector Forum.
Gemma Adlin.
Hello, I'm Gemma Aldin. I'm the Employer and Partnership Manager with the Department of Work and Pensions. I'm here today for Sarah Newham.
Thank you. Apologies for mispronouncing your surname. Jodie Wilson.
Hi there, I'm the Engagement Manager at Healthwatch Cornwall.
Brilliant, thank you. And Chairman, I believe that in terms of officers, myself, you've got Lynn, Davey from Democratic Services, who is producing the meeting, Heather Langstaff, who is live streaming. In terms of presenting, Gareth Walsh will be in attendance, Matt Sharp and Carolyn Andrews.
Great, thank you very much, Leanne. I just want to read out a very short statement. There has been a a slight change to the membership of the Health and Wellbeing Board. So if I can just update the board on some of the changes to the board's membership. So the council has recently assigned the role and responsibilities of the statutory director of adult social services to the service director for adult care and support. Previously, the statutory DAS role sat with the strategic director. On the advice of our head of legal, the chief executive has made a formal decision to update the membership list to reflect this change. As part of that decision, the opportunity has also been taken to update the whole membership list to better reflect the current membership of the board. Some flexibility has also been created in relation to stakeholder members of the board, so far as possible, by referring to nominees rather than their specific role titles. The council's constitution will now be changed to reflect that. But there have been no changes to stakeholder representatives on the board as a result of this decision, and if members of the board would like to review the decision, I'm happy to circulate the link to the papers which have been published on our website. The Chief Executive's decision also included a recommendation that early in the term of the new council, so the elections are on the 6th of May, so the new council will be formed after that, there will be a more detailed review of the membership of the board, which I'm sure we will all support. And that was from Matt Stokes, our head of legal. So just to make members of the board aware of that there will be changes, and clearly this will be the last meeting of the current council. Leanne, could we take apologies for absence, please?
Yes, thank you, Chairman. Some have been covered in our introductions. So we have apologies from Helen Charlesworth-May, with Natalie Jones substituting, from Sarah Newham with Gemma Alden substituting, from Chief Superintendent Jim Pearce with Miles Topham substituting, and apologies from Mary O'Dunn.
Thank you very much. Are there any declarations of interest for this meeting? No, okay, thank you. We've got the minutes of the meeting held on the 12th of November 2020, pages 1 to 5. I'll take them both for accuracy, and if we're happy for those, are there any matters of accuracy or anything that anyone would like to say on our previous minutes? Everybody happy with the minutes as they stand? Just checking, Leanne, do you require a vote to sign off these minutes?
I do, and I would just need anyone who wasn't at the last meeting, then we would assume abstention. I will still read them out, but just to say that anyone who wasn't at the last meeting would need to abstain. We need a proposer and a seconder for those.
Yeah, could I take a proposer and a seconder, please, if anyone's happy to do that?
Propose Mike Thomas.
Thank you, Mike. Chris, are you happy to second?
Yeah.
Thank you, Chris. We've got a proposer and a second. Would you be able to take the vote by roll call, please, Leanne?
I shall. So, Chris Blong, are you for, against, or abstaining?
For.
Helen Boardman.
Abstaining.
Thank you. Natalie Jones.
Abstaining.
Thank you. Paul Cook.
Abstaining.
Thank you. Councillor Hawkin.
For.
Thank you.
Gemma Alden.
Abstaining.
Thank you. Councillor Olivier.
For.
Councillor Painter.
For.
Miles Topham.
For.
Councillor Rochell.
For.
Meredith Teedale.
For.
Thank you. Councillor Thomas.
For.
Rachel Wigglesworth.
For.
Thank you. Jodie Wilson.
For.
Suzanne Wixie.
For.
Okay, thank you. Of those eligible to vote, we have 9 in favour, so they are carried. Thank you.
Thank you very much, Leanne. Moving on to item 4. Were there any questions from the public?
No questions were received, Chairman.
Thank you, Leanne. Moving on to item 5, which is Smoke-Free Cornwall annual update. And I believe Gareth Walsh is with us. We obviously have the report in front of us, but I believe you've got a few slides you'd like to share with us, Gareth.
Yes, I do. Thank you. Let me just get my presentation. Hopefully people can see my presentation.
Yes, it's on screen now. Thank you.
Thank you. So I think it's worth reminding people that smoking is still the leading cause of preventable death in England, in the UK, and in fact the world. So smoking accounts for over 74,000 deaths in England, and in Cornwall it's over 900 people every year die because of smoking. For everyone who dies from smoking, at least 30 people live with a serious smoking related illness such as cancer, heart disease, stroke, diabetes and COPD. Current smokers are also 30% more likely to be admitted to hospital. The latest adult population surveys indicate that prevalence is actually 15.2% in Cornwall, which is higher than the previous year. It's actually higher than the England average and the Southwest average. I've included Wiltshire, which is in the southwest, but is also the statistically nearest neighbour as well for comparison. It's important to note that there is a stark social gradient to smoking, and routine and manual workers are more than 2.5 times more likely to smoke than those in other occupations. Those who can least afford it smoke. It costs Cornwall an estimated £117 million a year due to tobacco expenditure, whereby there is revenue from tobacco. The cost is over 50 million in the difference. Ash has estimated that when you take net income and smoking expenditure, 24% of households with a smoker fall below the poverty line in Cornwall. If these smokers were to quit, over 3,000 households in Cornwall would be elevated out of poverty. There's no surprise that coronavirus is a respiratory virus, and that nearly there's twice as the odds of severe COVID as a smoker. There's also some evidence that current smoking, compared with never smokers, is associated with greater disease severity, those who are hospitalised for COVID-19. Evidence suggests that people with significant comorbidities, such as COPD, are at increased risk of severe symptoms from COVID. With the first lockdown, this presented with various challenges. The Stop Smoking service had to quickly transition to remote delivery of stop smoking support, making it flexible for their client group. With reduced referrals from primary care, there was alternative pathways needed to be done, and these were set up quickly. Nicotine replacement and other therapies had to be delivered differently because they could not be face-to-face. So in the last year, an email-in voucher was developed directly to pharmacies, as well as e-cigarettes for those in temporary accommodation. Remote methods were exploited, such as use of Teams and other virtual and social media, as well as telephone support. During this period over the last year, there was various successful social media and comms campaigns, such as #QuitForCovid, to encourage people to stop smoking. During this time, although much of the face-to-face engagement would typically done with tobacco control was stopped, there was still an opportunity to illegal tobacco operations, and to date there's been four investigations since April 2020. The next steps for Smoke Free Cornwall would be to strengthen links with the NHS and make sure that those pathways interrupted by COVID-19 are restored and bolstered. In addition to this, Smoke Free Cornwall Tobacco Alliance will look to have a detailed action plan based upon our 9 priorities that we identified in our strategic plan. This will ensure that comprehensive tobacco control activity is a core part of the COVID-19 recovery plans. I'm open to any questions.
Thank you very much, Gareth, and thank you for those stats. I think it is quite stark when you look at what has happened and how Cornwall is still behind others in the southwest. Rachel, would you like to come in first, please?
Thank you. I just wanted the opportunity to say, thank you, Gareth. I think you've outlined what the challenge is in terms of the impact on health and well-being. I just wanted to, we quite often, I think that smoking and the sort of issue of smoking is all, we've done our bit, we have the smoking ban, we have had a big reduction in smoking prevalence across the whole country and in Cornwall, but we're still seeing that really stubborn higher rate of smoking that is prevalent in Cornwall, and particularly in those routine manual workers, which, as Gareth said, does really contribute to our health inequalities. And this is the focus of the board, is to understand the drivers and address drivers of health inequalities. Smoking remains one of the top ones, however much there's a whole variety of other areas. Some of those behaviours, and particularly smoking, they make up that difference in life expectancy for some of the people who live in Cornwall. So really important issue. And I think, also if you note that cost element that Gareth highlighted, where we have challenges in our sector, we clearly know, and that isn't all costs to the health and care sector, it is costs to the whole of society, but it's still a really big dent in the resources that we have in the community, as well as the impact on people's lives. And also the clear read across our health and wellbeing strategy has one element, which is to have healthy bodies, and as part of that, promote lifestyles and behaviours that protect our health. So really, it has a very strong read across to our ambitions in our health and wellbeing strategy, and also those that are related to income and poverty, because as Gareth has explained as well, smoking, it costs. So I think that lots of reasons that the Health and Wellbeing Board should be focused on this, and I commend them to look at the papers that accompany Gareth's front paper, because there's a lot of detail in that, but it certainly shows that this isn't an issue for Cornwall that hasn't gone away, however unglamorous, and we need everyone's help to focus attention on some of this aligned to our health inequalities work across the system.
Thank you, Rachel. And I think it has been, with COVID, it's been interesting having the lockdowns and obviously not going out and seeing so many people. We're not doing our daily routines that perhaps we used to, travelling to work and obviously working from home. I think it's quite stark now how you notice people that are actually smoking, and obviously because of the smoking ban, perhaps it's more prevalent where you see them outside of buildings. But I think it is something that I've consciously noticed just in the last few weeks travelling around, and I think it's something that we do need to keep a focus on, and it is important to to look at what we have been doing and what we can get back doing as well. We've got some questions coming in. Please put an X in the box if you have any questions or comments, but could I take Cornelius Olivier first, please? Cornelius.
Yeah, thank you, Adam. I just wanted to ask Rachel and Gareth, the statistic for the number of premature deaths caused by smoking or linked to smoking is really, really striking, because there is a tendency to think we're, or at least, the worst is over with smoking by some distance. To what extent is that statistic of legacy, in the sense that, it's people who were affected before the decline in the number of smokers happened? So is there going to be a kind of, even if things stay the same as they are now, is there going to be a decline in the number of premature deaths?
Shall I take that one?
Yeah, go on, Gareth.
So that statistic is based over the last about 3 years of 2016 to 2018, and it will, obviously that's been refreshed, and it's based upon ICD codes in hospitals of illnesses relating to smoking, so your cancers, your COPD, etc. And so that will be refreshed. But our ambitions, as part of the 9 strategies, is to tackle that both in primary care and also secondary care. So when obviously people admitted from attributable smoking illness will be addressed then.
Thank you. Rachel, do you want to come in as well?
Yeah, I think Gareth partly answered that question, is that it's people who, you know, have smoked and then are being identified through sort of death and illness in care settings. But I think the other worrying part is that we do have a higher rate in the surveys that have done of smoking in our sort of younger age group. So whilst it is less than it would have been in previous years before those sort of smoking ban really hit, but you know, from memory, it was around 40% were smoking prior to that. So we have brought that down, but those very younger age groups, so I think it's around the 15, the survey does suggest that we do have a higher rate compared to some other areas, particularly in the southwest, that are starting smoking. So whether that's you know, sort of different, there's different behaviours, but it's something that shows that we've still got a problem, I guess.
I mean, I suppose what I was trying to ask, and perhaps didn't express quite, I'm not recommending complacency to anyone. All I'm saying is there, if the proportion of smokers remained where it is now, would there be a decline in the number of people dying prematurely, you know, with smoking associated illnesses, simply because their problems, their medical problems, stem from the period when 40% of adults smoked as opposed to 15? Is there an inbuilt, so we're still on a trajectory down for deaths, even if the number of smokers remains the same? I hope perhaps that doesn't make as much sense as I think it did, but
I'm happy to answer that. So obviously, if you're a long-term smoker, 1 in 2 long-term smokers will die due to smoking, and obviously they'll have ill health sooner, and they'll die 10 years, typically 10 years younger. So that isn't going to change. So what we need to do really is encourage people to stop and stop as soon as they can, because we're still going to get that amount of deaths every year unless we can really reduce the prevalence of smoking.
Okay, thank you for that. I'm a bit clearer now. Thanks.
Thank you, Cornelius. Sally.
Thank you. So some of the things I was noted down to say have been covered already. I would say a thank you to Gareth and the Smoke Free Alliance for all of their work, particularly being creative about ways to continue with priorities through the pandemic. Rachel mentioned then the sort of links with poverty, which I think we need to keep as a strong focus, and also young people, which was one of the things I was going to bring up. I know that I spent some time talking to Gareth about that, and I think probably COVID has not helped us to progress some of those thoughts, but what I'd really like to say as a sort of thing from me as a last opportunity for me to attend a health and wellbeing board would be to ensure that link across. I can see Meredith's going to come in next to ensure there's that link across with Together for Families, particularly around that stuff that we've talked about, Gareth, around injecting some youth voice into some of the planning and thinking around smoking cessation, because I think that would be a really powerful thing. We all tend to think we know what's good for young people, but when they're actually involved in part of that process themselves, it's usually more powerful. So I really hope that's something that could be progressed over the coming years.
Thank you.
Thank you, Sally. Meredith, did you want to come in?
Yes, thank you. And it is on the same point, so I apologise, Adam, but I just wanted to check what our current figures are around the percentage of 15-year-olds who are smoking. In one of the documents, the 6.9% figure is from 14-15, which obviously for young people is very old data, being 7 years ago, and then now adults. So it would be good to understand how we're calculating, how we're gathering that information and what the data is, and that whether it is that trajectory upwards. And secondly, just to reinforce that it would be really good to get that read across. So Kate Evan Hughes is leading a piece of work around belonging, and I think this fits firmly within that belonging strategy. How we're talking and listening to our young people and understanding the possibility that this is whilst a risky activity, is also something that might well be something which is where young people are experimenting and not realizing the addictiveness of it, and how we hear their voice clearly in attempting to stop, make sure that message is clear about people not starting smoking.
Thank you. Shall I answer that? So Meredith, thank you for your support, and I would value your support in obviously progressing the smoke cessation for young people. There was something called the Way survey, which actually did see some. We've taken our figures, our data from the SHU survey, which is a local questionnaire to schools. And I'm happy to obviously go through that data with you. The SHU survey is conducted every 2 years. I believe the next one's going to be next year now. But so our targets, our stretching targets, are based upon those young people who smoke and people which have said that they would like support to stop as well. So this is also offering young people who would like to stop the support to be able to do that. But I'd value your help. Thank you.
Thank you, Gareth. Paul Cook, please.
Thank you. I was just considering again with the younger people. In my experience in general practice is that I have a lot of people when I ask them about their habits, actually they're smoking cannabis, and it's the mixing of tobacco with cannabis is the reason they're using tobacco. And I wondered if there's any sort of work to understand that at the moment and crossover with drug policy.
Thank you, Paul. We've worked in the past with We Are With You at Action, and we're looking to work again with them with that support. But I would value your help and guidance with that.
Thank you, Gareth. Yeah, good point, Paul. Chris.
Yeah, thank you, Adam. I think for me, I absolutely respect an individual's choice to smoke, and obviously the incentive is to try and dissuade them from smoking. But for me, it's ultimately a personal choice, and we can be as dynamic as we can be, but they will decide whether they will or will not smoke or stop smoking if they have started smoking. For me, the challenge is where that impacts upon others who have no choice. And that to me is more of a challenge to actually either raise the awareness, which I'm sure they have already, of the damage they're doing to family members in that same room with cigarettes being smoked, all the effects of passive smoking, and we know all the side effects that causes. And so for me, where does personal choice then stop in the greater health of friends and family members who are exposed to that smoking culture? And I was quite shocked when I read the figure that, I mean, I know cigarettes are expensive, I don't smoke myself, but if we could take several thousand families out of poverty by stopping smoking, that is a staggering figure. So it's just a better understanding of where individual choice usurps the greater good of those around them. It's what I'm struggling with.
Thank you, Chris. So a few things there. So as regards health and social inequalities, smoking for many, for those who can least afford it, is the main cause, and it's often intergenerational, as you've noted. So it's families after families, and it's being, you're born into it in many, and statistically, if two parents smoke, then you're likely to follow that path. We are working with smoke-free homes and smoke-free initiatives, and it's an informed choice, but you're right, if people are not ready to stop, or then there's nothing you can do. So ours is to inform people, to encourage and have the support for those 70% of smokers do actually want to stop, have tried several times. So it's to encourage them, and if they're not ready to stop, is to take it outside, really, as you said, so you don't actually have that secondhand smoke. Thank you.
Thank you.
Thank you both. Any further questions or comments? I think there's certainly, I think perhaps it's not always people would understand or think about the impact of cost. And I think I'm afraid I couldn't tell you the cost of an ounce of tobacco or a packet of cigarettes. But I know it's not cheap, I guess, because they're hidden from view as well. You don't tend to see them when you go to pay for petrol or go into your supermarket. You don't see the cost, but I think it certainly links into child poverty as well, as far as looking at our next item on the agenda, when potentially you're paying quite a large part of your income on cigarettes. So thank you very much for that, Gareth. I'm not seeing any other questions or comments. We do have some recommendations on page 6 of our papers today. So the recommendations are: number 1, to endorse the activities of Smoke-Free Cornwall Tobacco Control Alliance during 2020, and development of a Smoke-Free Cornwall Action Plan for 2021-22, which strengthens the NHS smoke-free approach and targets reduction in health inequalities from smoking. And recommendation 2, to resolve to continue to support the priorities outlined in the Smoke-Free Cornwall Strategic Plan. Can I have a proposer and a seconder, and then we'll take a roll call vote on those recommendations. Sally Hawkins, happy to propose those recommendations. Chris, you're happy to second. Thank you very much. Leanne, are you able to take the roll call vote, please?
I will indeed. So we are voting on the recommendations as just read out by the chairman, proposed by Councillor Hawkins, seconded by Chris Blong. I'll go to the roll call. So you need to indicate whether you're for, against or abstaining. Chris Blong.
For.
Helen Boardman.
For.
Natalie Jones.
For.
Paul Cook.
For.
Councillor Hawkins.
For.
Thank you. Gemma Alden. For. Councillor Olivier. Councillor Olivier.
For.
Thank you. Councillor Painter.
For.
Thank you. Miles Topham.
For.
Thank you. Councillor Rochell.
For.
Meredith Teasdale.
For.
Councillor Thomas.
For.
Thank you. Rachel Wigglesworth.
For.
Thank you. Jodie Wilson.
For.
Suzanne Wixie.
For.
All carried. Thank you, Chairman.
Thank you very much, Leanne. Right, moving on to agenda item 6, which is child poverty, food insecurity and financial precarity during COVID-19. Matt, welcome Matt, and Matt Sharp will take us through these pages. Thank you, Matt.
Hi, thanks everyone, and thank you for the opportunity to talk you through the paper today. So the paper is Poverty, Food Insecurity and Financial Precarity during COVID-19. And as much as the paper talks around these issues, it's important to remember that obviously all of these issues were there previous to the pandemic, and we're summarising here really some of the challenges that have been brought to light due to the restrictions. So the report highlights the issues of poverty, food insecurity and financial precarity, which have become exaggerated due to the guidelines introduced to manage the coronavirus pandemic, and how the constant pressures experienced by people experiencing these issues can contribute to a wide range of negative health and wellbeing outcomes. The report describes the mitigations that have been introduced by Cornwall Council and the central government to help alleviate these negative outcomes, but also summarises the massive and important role that the community sector has played and the work that they've put into to support everything that's come through from the council and central government. So the impact of COVID-19 and its response has highlighted the critical issue for the increasing number of households that experience these food security and poverty. And in the UK, measures have recently been added to the local and national surveys to ascertain the level of food insecurity. But currently there's no single reliable measure to enable the local authority directors of public health to quantify and benchmark the level of need at risk in their particular area. And it's probably important to say at this point that when we talk around food insecurity, and there are definitions further down in the paper, food insecurity isn't just about being able to afford food, it's also around access to food. So the conversations that we have around food insecurity are very much about the wider food system as well, which tie into the climate change agendas and the climate emergencies as well, because our whole food system is affected, and that can affect the food insecurity. Cornwall's voluntary and community sector organisations and individuals have delivered the essential services during the pandemic that have supported a large number of adults and children through very challenging times. And really what we're highlighting in the report is how these have had a massive impact, but also that the relationships developed here have got sustainability to them, and we're working really closely with those community organisations to be able to increase the support that's available and target it to where it's needed, but also to be able to try to work on that prevention side of things so we can do that element of it to help people stop experiencing food insecurity. Many of the issues summarised in the paper all have their roots in poverty, so food insecurity, fuel poverty, period poverty, it does all directly come back to poverty overall and not having the means to be able to take a full part in society, not being able to heat your home, pay your rent or buy the essentials, and that feeling for people, it's a constant pressure to not have that lifeline available to you. That puts that stress, which leads to those wider health problems, and the impact obviously that has on children as well for those families that are experiencing poverty. The child poverty aspect is obviously something that's picked up in the health and wellbeing paper, the strategy, sorry, an important part there. And so a lot of the information here and some part of the recommendations will contribute to the knowledge and intelligence to be able to address those priority actions in the strategy. The paper summarises many of the actions taken. I've discussed around the community response with the Voluntary Sector Forum and the role they've played with the Cornwall Food Access Alliance and the number of new organisations. I think it's really helpful to think back to pre-pandemic, where we probably had 30 to 40 emergency food organisations that were active in Cornwall, including food banks. And during the course of the emergency that was realised, we now see around 180 organisations. So the growth in that area has been huge, and one of the big challenges around food insecurity is about how we work with those organisations and how we support them to be able to step back from that emergency provision into where we are now, recognising that issue was there before. Organisations like the Trussell Trust have changed their ambitions, that they will eradicate food banks. They see them as not the model that they want to be able to continue with. It's about a problem, but that issue of poverty and access to food is preventable, wholly preventable. And the work that they'll be doing is to link with other organisations and bring in ideas like the Food Bank Plus model, where they do more work around debt management and advice to be able to support people through those crises that they're experiencing, so that when they've moved through that journey, they're able to have the dignity and respect that they don't need to access those food banks and emergency food provision. The report has a couple of recommendations in it, details why they're there really. The first recommendation is that the Health and Wellbeing Board endorses the approach of the Cross-Service Food Security Group. And the second is that we measure food insecurity as a chapter of the Health and Wellbeing Board Joint Strategic Needs Assessment. One of the paragraphs in there talks around those challenges of measuring food insecurity. Until we can do that on a local level, it's very difficult to target and work with services that are providing that emergency response and be able to understand actually the metrics around where the next challenge will be, how we maybe look to predict where issues can start to arise from. So the measurement side of things is critical really to be able to reduce and then prevent food insecurity and food poverty. The Council's Food Security Group started as just really a coordination of various organisations that had come together and was formalised really with a fund from DEFRA. And the work that's done has been able to support those community groups with money being spent on food storage, delivery freezers, as well as volunteer expenses. So that support's all been in the community. The COVID Summer Food Fund is what we've used to provide the free school meals and the £15 vouchers that have gone to children, which has been really appreciated by parents and schools, and has been worked through the Education Service, who have delivered a really valuable scheme. We've also just finished the COVID Winter Grant Scheme, which has been closed down, which is £2.4 million, which has provided that cash first solution to alleviate those issues of fuel poverty and food poverty. And we've taken a lot of learning from there as well, which we'll be able to come back and update on with further reports. So we're focused on food insecurity, but the reality is anyone can experience poverty, and the events that we've experienced now with the pandemic have shown that many people that have never been in a situation of financial precarity are in one, and the crisis that can come from that, and the health issues and negative health issues can change really quickly, whether it's through bereavement or illness or redundancy or relationships breakdown, where life circumstances can take a turn really rapidly, and it can all push us into those circumstances, and they can become difficult to escape. And really, I think by measuring it and taking that step that we're doing, we can start to support people and work on that prevention element. That's all from me. I can see some hands have gone up in the chat, so probably happy to take questions now.
Yeah, thank you very much, Matt. Thank you for that. And it's a good paper showing the work that has gone on. It's certainly we've seen the very high profile of food poverty, and certainly free school meals with Marcus Rashford and others. Certainly during the pandemic, it obviously was very high on government's list as well. Quite embarrassing for government, I think, doing so many U-turns. I've forgotten how many they did do in the end on free school meals and other areas. But I think that generally it was positive as far as the work coming out of that. Can I bring in Rachel and then Sally, please? Rachel.
Thank you, Chair. And thank you, Matt, for the paper. I think, wanted to again pay tribute to the work of the community in responding to the sort of emergency food crisis that we had, because I think, as we all know, that's when sort of Cornwall comes to, shows its strengths really. But that is absolutely essential, and the community groups went above and beyond, as do a lot of people who run these food banks, day in, day out, because they're not new, they were there before. And I know that one of the MP, Sarah Newton, did an inquiry into food banks and food poverty and hunger some years ago. I'm sure all of the findings from that report remain. So I think we are facing some challenges around some structural issues that do not support people to be living on a reasonable income, which may be about benefits levels, it might be about wage levels, but this doesn't just affect people who are out of work. It is, also, again, as we know, the costs of living, people in work can also fall into that position. But I think so clearly poverty is an important part of our aspirations to address child poverty as part of our strategy. So just wanted to bring back, we all agreed as a board, and our strategy has an ambition around that we have our children lifted out of poverty and protected from adverse childhood experiences. And if we're to be looking at achieving and moving towards those ambitions, I think we would need to do some collective thinking about our best approach to that. But a question about the membership of the board and whether we do want to include some economic partners in addition to people like DWP. So I think it's just a comment question back to the board when we're considering that in the new administration, whether the local economic partnership might play a bigger role in bringing this agenda together around how we are bringing people out of poverty as a part of improving health and opportunities for children in particular in that, we know the health impact of that. So I'll stop there, but clearly on this important area again.
Thank you, Rachel. Sally?
Thank you, yes, and I think when Matt and I first started talking about holiday hunger with a really small budget and pretty much on our own, events overtook us really, and COVID has been hugely important in absolutely all the things that Rachel's just said in terms of voluntary response, but also Matt and the Food Alliance work in terms of trying to pull together and say, this is something we need to talk about together. And that's really, really valuable and needs to be continued, and is one of the positives to come out of the pandemic. I've been really pleased with the work of the holiday activity and food programme. I think that's a really good step in the right direction as well, to be able to see those things happening in the next holidays coming up. But my word of caution here is that these are time-limited pots of money. You referred to government U-turns. There have been so many, but the current programme is not baked in as a long-term aim. So I think that probably what I would want to suggest is that the Health and Wellbeing Board would also write to government and say it is important, based on Rachel referenced the all-party parliamentary group on holiday hunger, those sorts of bits of stuff that happened from 2017 onwards, and Cornelius will probably mention the more recent reports. We know that government knows that some of the things that can help here, and it doesn't cover the whole food insecurity bit, but we know that some things that they can do that can help are picking up that need during the holidays. There's a reference in the report to the DfE research around the benefits for lower income families around universal infant free school meals. Frankly, if I was the government and I had a limited pot of money, then I would be using it in a more targeted way than that programme delivers. So putting that into the holiday hunger. The point I'm making is that we do not have a sustainable position going forward. The council has found money to put into the system in this way, but again, that's not baked in. It should be baked in at a national level, and I believe that's something that we should be asking of government. And my last plug, and I'm sorry if it's boring for those people who've heard me bang on about it before, but Healthy Start vouchers, they are ways in which people are offered fruit and veg and vitamins in that 0 to 5 age group. We have seen a massive increase in eligibility, but not a corresponding increase in take-up. So it's really, really important that people do all they can across all their system to plug that opportunity, because we can see in the numbers that in some areas it's as low as 40% are taking up something that they're entitled to. So really, really important that we do that. Very encouraged actually by what you were saying then about the direction of Trussell Trust. I think one of the important things for the Food Alliance going forward is looking at how they absolutely bake in moving on, lifting yourself out of that crisis situation, and that absolutely needs to be about working with people on debt recovery, debt understanding, managing money, budgeting, all of those sorts of things. So it's enough from me, because this is clearly one of my soapboxes.
Thanks, Sally. Can I bring in Meredith and then Cornelius, please? Meredith?
Thank you. So just 4 points. The first one is that I agree with Rachel. I think that link with DWP and universal credit and all of those other elements is absolutely imperative. So it would be good to look at that and look at potential membership within the Health and Wellbeing Board. I also think that the link with the paper, Matt, and we've had this conversation a number of times, is around the digital divide, which was also exacerbated during COVID-19, and how that also has an impact on poverty and children's potential future attainment. I want to thank the schools who've also wrapped around and supported around free school meals, and they've played a really key role over the last year in protecting families and children around poverty, and going above and beyond in many cases, and dealing with a lot of different guidance and, as you've said, different U-turns that have taken place. And then finally, I think it would be really helpful as a Health and Wellbeing Board sitting underneath this piece of work that we reflect on the Children's Commissioner's report, the outgoing Children's Commissioner's report, Anne Longfield, that particularly highlighted nationally that the correlation between a child in need with free school meals and on an education healthcare plan and their future, the likelihood of their future attainment, which we also know has an impact on quality and quantity of life, would be something really good to channel some of our thinking around.
Okay, thank you. Cornelius, did you also want to raise a point of a potential extra recommendation?
I did, Adam. I should start by saying that I think that the council responded very well to the food poverty issues that were exacerbated by the pandemic. They were there already, but they were exacerbated. You know, I've raised concerns about not having a dedicated fund in this financial year for food poverty organisations in Cornwall, but that doesn't at all sort of mean I'm deprecating the efforts that the council has made in this direction, you know, in a whole range of ways. So, but I think the additional recommendation, you know, elected members of the council who are members of this board and others will be aware that back in November, the council collectively endorsed a call for the government to implement the recommendations of its own inquiry into food poverty, the Dimble report. You know, we all voted it. I think every member present voted for that, who's also an elected councillor, on November the 24th. So, and we voted to call upon the government to expand free school meals provision. So during the holidays, remove the income cap so that that free school meals are eligible for anybody who's claiming a means tested benefit, and applying the same to Healthy Start vouchers. So I would like the board to endorse that call made by elected members in November and follow up Sally's suggestion about writing to the government on that theme. We're all aware now, in a way that perhaps people weren't previously, the importance of free school meals, not just in tackling food poverty, but improving educational attainment. So I think it's appropriate, as we have this report in front of us, to have a recommendation 3, which the Health and Wellbeing, you know, the Health and Wellbeing Board endorses the call from Cornwall Council as expressed in the motion agreed at its meeting of November the 24th for the government to implement the recommendations of its own Dimbleby inquiry into food poverty for the expansion of the provision of free school meals and Healthy Start vouchers. So that's all I'm asking the board to do, endorse that call that we collectively made as elected members in November and write to the government to that effect. I hope that didn't become too confused, Adam. I mean, you'll probably remember the meeting yourself, but that's what I want to propose.
Okay, now I'll ask Leanne to just take a note of that if it's an additional recommendation. Leanne, are you content that you've got the wording?
Could Councillor Olivier just either read it out again or ideally put it in the chat for me so I can copy and paste it out, and then I can read it back to members when we go to the vote, should it be proposed and seconded, or seconded, because I think Councillor Olivier, have you just proposed?
I proposed. I don't think. Do you want me to read it out to you now, or do you, because that would be quicker or do you want me to type it into the chat while other people express their opinions?
Either way, I can type quickly if you speak slowly.
Yes, the trouble I have speaking slowly, I'm afraid, is often very difficult. Okay, would the chair mind if I read that out now?
Yeah, go on, Cornelius, read it out, and I'm sure Leanne will take it down.
The Health and Wellbeing Board endorses the call from Cornwall Council as expressed in the motion agreed at its meeting of November the 24th for the government to implement the recommendations of its own Dimbleby inquiry into food poverty for expanding the provision of free school meals and Healthy Start vouchers. I thought it was better to say that rather than go into what the recommendations actually were, but generally speaking, they were for expanding that more people should get free school meals more often, and the same apply to Healthy Start vouchers. Is that okay, Leanne, or do you want me to, was that too fast?
So I've got that the Health and Wellbeing Board endorses the call from Cornwall Council as expressed its motion on the 24th of November for the government to implement the recommendations of the Dimbleby inquiry for school meals and Healthy Start vouchers.
And the Dimbleby inquiry, yeah, that summarised for the expansion of the provision.
For the expansion of
the provision of free school meals and Healthy Start vouchers. And I also said of its own Dimbleby inquiry because it was a government inquiry.
Okay, thank you for that, Cornelius. anybody who wants to come in on that as well, we can do. I'll ask for a seconder to add that to the recommendations shortly. But Mike Thomas, you wanted to come in, Mike.
Yes, thank you, Adam. I'm happy to second that if you need a seconder. All that I've heard this morning, I've fully agreed with, and you know, Sally expressed many of the things that I feel strongly about, and the position that Meredith and Sally are in, they have far greater knowledge about what's going on. My question to Matt, and thank you, Matt, for a very thorough report, which was very interesting to read indeed, is the 5 weeks issue still a major cause of people needing food banks, the 5 weeks before universal benefit kicks in? So that's a question to Matt. Other people may know the answers as well. The other thing is the school meals area. I would certainly hope that we could consider or find funding to explore this area. And I wonder whether we ought to link with this the whole issue, the issue of the management of waste food. I think we've got this contrast where we have so much food that is wasted, yet at the same time we've got this real issue of food poverty. And Matt will know also the work of the Hive, no longer with us as I understand it, and their management of waste food really provides a model where a sustainable model where we could actually see schools actually be using that sort of model to actually provide meals for young people. And just a final observational question: are the issues general throughout Cornwall, or are there particular areas where the need is coming through far greater? Because I'm certainly conscious in the area that I am that there has been a declining use time of the food bank. So a mixed collection of issues there, Adam. I hope we can get some conversation on that.
Yeah, thanks, Mike. Matt, are you able to come back on some of those?
Yeah, absolutely. So on the food bank side of things and the user access, there's a real mix. I think what they're seeing at the moment from food banks, and particularly Trove Food Bank have sent a report in, that the majority of people accessing and needing their service now are those that are working, and their families and individuals that are working, but on low incomes. The report did highlight around that issue that the food budget is often the one that's cut first within a household. It's the easiest to cut and reduce. Others are fixed, and so those families and individuals are accessing food banks. The majority for Truro at the moment, the work is on low incomes rather than being out of work. On the Hive, they are still in operation. They now have a new set of trustees, and they're operating currently from Fenton Fen and Farm as part of Newquay Orchard, and we're still in discussions with them. Probably important that food waste is an issue, but it's not the way to resolve food poverty.
I agree.
And so that's yeah. And then you need to remind me of the third one. Sorry, Mike.
It was basically locality. Is it simply is the issue spread throughout Cornwall, or are there some areas that are more affected?
Yeah, so what we know currently is that it's spread throughout Cornwall. It's rural, so very rural, as well as in those more urban areas of Cornwall, where there's higher population areas. Obviously, there's higher numbers of people experiencing food insecurity, but the detail of which is difficult to know. The Family Resources Survey that's been released is again, it's great information, shows food insecurity across the country, but is only based on 1 month rather than the whole year, which we need to do because people can move in and out of food insecurity. But the recommendation is to try to cover off some of that detail to understand actually where those areas are, what those issues might be. Again, coming back to food insecurity being partly about financial affordability, but also about access to appropriate shops. And if you live near a corner shop and 20 miles from a supermarket and there's no public transport, then that also affects your availability to access a well-balanced diet. And puts you into experiencing food insecurity.
Thank you for your answers.
Thank you.
Thank you. Thanks, Mike. Cornelius, did you want to come back?
Sorry about that, Chair, I was on mute. Yeah, I'd like to thank Mike for seconding my motion, though, I know he understands the issue in the same way as I do. In terms of causes of poverty, I will, the economy is returning to normality, in terms of, the end of lockdown in a visitor-oriented economy means perhaps fewer people are going to be on universal credit. But what I am finding quite terrifying is when I read about the increase in rental costs, housing rental costs in Cornwall, because I think that's going to be a driver of, it was already a problem, and I think it's going to be a driver of poverty. If given a choice between, if people have to choose between paying their rent and paying for food, then rent is generally speaking going to come first, the priority of keeping a roof over your head. Yes, sorry to sound quite so gloomy, but I am really worried at the way housing is performing in financially in Cornwall at the moment.
Yeah, I think that's certainly right, Cornelius, with the way that housing is, and clearly the pandemic has impacted on that as well. Helen, did you want to come in? I know you've posted several bits in the chat box about issues that you obviously see and your organisations see. Anything you want to add in on this one?
Thank you, Adam. It was I was really interested in some of those numbers that Matt shared earlier around the growth in food bank support from 30 to 40 to up to 180. And I just wanted to appraise colleagues that often these food banks are a food bank plus model, whereby they're providing families and individuals with lots of other care and support, both in terms of practical assistance around their hardship, and also, mental and emotional well-being support as well for those that are isolated and struggling with those issues. And so reducing food banks shouldn't ever be our sort of reducing food dependency through food banks. Definitely, yes, we need to, improve the economic well-being of individuals and families, but we must be aware that there are other support services wrapped around all of that, where local people are going and have that trust, that rapport, that depth of relationship, and they're having meaningful engagement. And there's also a lot of assertive outreach as well in those communities. So I just wanted to raise that, and also to just publicly thank the Reverend Andrew Yates and Jane Yeomans from Transformation Cornwall for chairing the Food Access Alliance over these months. It's not been an easy ask, but they've done an outstanding job, and I just wanted to publicly make colleagues aware of that.
Thank you, Helen. I think the links are absolutely there, and a food bank doesn't sit on its own, because I think anyone that comes to a food bank, you can pretty much guarantee that's not the only issue going on within either that individual or that family. So I think many other support services work off food banks, as well as other food services that will then signpost or provide directly assistance that's needed. We've got the extra recommendation. I'm not seeing any other indications of questions or discussion. Leanne, I know Matt read out the first couple of recommendations. I don't know if you want to just reiterate the third recommendation just before we take the vote.
Yeah, so if I just run through them, so that the Health and Wellbeing Board endorses the approach of Cornwall Council Cross-Service Food Security Group and nominates a representative from the board to join the Food Security Group. That the Health and Wellbeing Board recognises food insecurity as a priority issue and commits to measuring food insecurity as a chapter of the Health and Wellbeing Board Joint Strategic Needs Assessment. And then this is the third one which has been added, that the Health and Wellbeing Board endorses the call from Cornwall Council on the November the 24th meeting for the government to implement the recommendation of its own Dimbleby inquiry for the expansion of school meals and Healthy Start vouchers. So they're the three recommendations that I have.
Yeah, with the first recommendations, do we have a nominee that's willing to put their name forward as far as somebody from the board to represent the board and join the food security group? I'm guessing some members of the board may already be a part of that group. I'm not sure if that group has been set up yet, Leanne?
Not that I'm aware of. Possibly if we make the recommendation, and then the nomination could be fed back to the board, and we can speak to the who's on that food security group already, and just look at the membership and then go out to the membership of the board and ask for a nominee, which could be fed back at the next meeting.
Okay, thank you. Cornelius, are you happy to propose all the recommendations with the addition of your extra? And Mike, are you happy to second?
I'm happy to propose.
Thank you.
Yes.
Thank you, Mike Thomas, to second. Leanne, would you like to take the roll call vote, please?
Fantastic, thank you. Board members, you are voting for, against or abstaining, and I will run through the membership now. Chris Blong.
For.
Helen Boardman.
For.
Natalie Jones.
For.
Paul Cook.
For.
Sally Hawken.
For.
Emma Alden. For. Councillor Cornelius Olivier.
For.
Councillor Adam Painter.
For.
Miles Topham.
For.
Councillor Rob Rochell.
For.
Meredith Teasdale.
For.
Mike Thomas.
For.
Rachel Wigglesworth.
For.
Wilson.
For.
And Suzanne Wixie.
For.
Thank you. That's carried all in favour, Chairman.
Thank you very much, Leanne. Thank you, members. Moving on now to item 7, which is the update on the integrated care system development following the Health and Care White Paper. Pleased to welcome Carolyn Andrews, who's joined us, I do believe. And Carolyn, you're going to take us through a few slides and discussion.
Thank you, Chair. Good afternoon, everyone. I'm Carolyn Andrews, Transformation Director for the Integrated Care System, and I am just going to run through some high-level headlines and a few slides, if I may. You've already had the slides and you've had some papers, so hopefully you've had a chance to read those. I think before I start, one of the things I'd like to just kind of highlight is that this is very much a fast-moving process. Obviously, it's a very tight deadline to April 22. It's very much an iterative process because at the moment we still don't have all of the information, so we still have some unanswered questions. Further information obviously will be expected through Q1 and Q2. And we've also got some timeframes now around, subject to the parliamentary process, about when readings and second readings will go through. So it's anticipated that the first reading of the bill will be the first week in May, second reading the third week of June, House of Lords approval in November, Royal Assent February or March, with then the new integrated care system legal entities being established from the 1st of April. And I think we need to recognise that in Cornwall and the Isles of Scilly, there's a lot of good work already been done. We have already been designated as an integrated care system in November last year, and we were designated as a mature ICS. So a lot of the things that we are seeing in the legislation and the requirements of an integrated care system, we already have some good foundations in Cornwall and the Isles of Scilly. We've got some great collaborative working across health and care colleagues and independent sector, and obviously with our voluntary sector colleagues. So there is a huge amount of work that's already been done. So I will just share my screen with you. And apologies to those that may have seen some of this already. So hopefully you can see my screen now.
Yes.
Chair,
yes,
could you just confirm? Thank you.
Yeah, thank you.
Thank you. So the triple aim is clearly written all the way through the White Paper, and that's one of the things that we've seen historically. What we've then got is 4 key themes from the paper. So working together to integrate care, reducing bureaucracy, improving accountability, enhancing public confidence, and additional measures. Now, I'm not going to go through all of those clearly, as I say, because colleagues have the pack already. But as I say, what I did want to kind of highlight and ask the Health and Wellbeing Board colleagues to recognise and acknowledge is that we're not starting from nothing. How we do business will change, but noting that we've already got some of these mechanisms in place. Timescales are mandated by NHS England and are being driven to ensure they're ready. ICSs are ready for April 22. And as I said, this is an iterative process. It will move at pace as further guidance comes out in due course, and a lot more is expected, as I say, through Q1 and Q2. So as I say, I'm not going to go through these in detail, but the highlights from these is it's about integrating care, health and care, and it's about integrating in two ways. So it's about integrating the NHS providers and commissioners together, and it's also about integrating our wider partners in Cornwall and the Isles of Scilly to make sure that we are working in a collaborative way to ensure that we are delivering the best quality of services that we can to the citizens of Cornwall and the Isles of Scilly. And the legislation is being put in place to enable providers to work more collaboratively together, because at the moment it's extremely difficult, as you know, and the legislation is looking to break down some of those barriers and enable colleagues to work in a more collaborative way without the barriers and the hurdles that we currently have. As I say, reducing bureaucracy. So this is around allowing some of the removals of those barriers. So things like some of the procurement rules and regulations that we have, and enabling people to come together to be able to deliver services and create services together, rather than everything being a really competitive process. Improving accountability and public confidence. I think that kind of says it's what it does on the tin. So this is about improving accountability of our system, showing that the citizens of Cornwall and the Isles of Scilly can see where those clear accountable lines are, and who is actually responsible for their care. There are some additional measures that the white paper talks about, and clearly some of these are really, really key. So the position of adult social care in the integrated care system, and it's not just adult social care, it's about social care across the board. They're looking at putting the Better Care Fund on a standalone legal basis. So there is information coming out about that, but again, further information to follow. Looking to improve the discharge to assess models. Discharging to assessment and discharging in general is a challenge everywhere, but what they're looking to do is to enable partners to work collaboratively together to build what that looks like and actually make it a smoother pathway, and ensure that citizens are able to be discharged properly. They're looking to be able to make direct payments to providers. And then some of the things that they're also looking at is tackling obesity, obviously high fat, salt, sugar foods, through restrictions on the advertising and labelling, and you will have seen some of that already. Putting Health Service Safety Investigation Board on a statutory footing. So the next few slides will pull out the key points for these, but it's not exhaustive. And as I say, I'm not going to kind of read through these line by line. The numbers that you see at the top are the page in the white paper and the section, so that should colleagues obviously want to go back and refer or have a look, then I hopefully have made it clear for where you need to go and have a look. But it's been really clear through the white paper that adult social care has to be better integrated into our integrated care systems. You know, we have a lot of collegiate working now, but it needs to be better and it needs to be further embedded. So obviously looking at how we can do that. Now, some of the social care legislation is kind of coming out now, but again, I think there's still some questions to be answered. So all of this is around how do we come together? So they're looking at the ICS legislation complementing and reinvigorating place-to-base structures for integration between the NHS and social care, so such as the Health and Wellbeing boards, the Better Care Fund and pooled budget arrangements. And for those that have seen the white paper, you will recognise that the Health and Wellbeing board is one of the statutory boards that make up the ICS. So they're looking at the Health and Wellbeing Board, the NHS body as it will be, because the clinical commissioning group will not be in the same format in April 2022, and then the new statutory board, which will be the Health and Care Partnership Board. The Better Care Fund, again, there's information coming out about that, but we've got questions that aren't answered yet. One of the things that we're looking around is how do we have that clearly defined role for social care within the structure of the Integrated Care NHS board, because we do need to give that greater voice to adult social care, particularly within planning and allocation. So at the moment, that's kind of some of the things that we're working through. And again, clearly recognising the Health and Wellbeing Board all the way through the paper and the benefits that it can bring. So they're looking also around data collection. So this is a big key theme through the white paper about how we collect data and the frequency in which we collect it. And this is across social care and health. And so they're looking at doing something different in the way that they collate their data, recognising that at the moment, the way health and care data is reported is very different. So there will be a new assurance framework for social care. This is one of the things that at the moment we're not quite sure what that will look like. Something that has come out after the white paper, which I have added in, is that the Care Quality Commission will also now oversee the integrated care system. So all of the statutory providers will still have their statutory responsibility to the Care Quality Commission, but now also the integrated care system as a whole will have a duty with the CQC. Again, we don't understand what that looks like just yet, but that has been made very clear to us that that will be a responsibility. So as I said earlier, the Secretary of State is looking to be able to make payments directly to providers. I don't have any further information on that. Other colleagues may, but I don't have any more information on that at this moment in time. And as I said about discharge to assess, there's clearly a drive to ensure that we are doing this in a smart and efficient way across health and care. It's a bit clunky at the moment, so there is recognition that there's more work to do. As I say, standalone powers for the Better Care Fund, and this is going to have a technical change, and there will be legislation to follow around this. But this is ensuring that the Better Care Fund is overseen and we know where the allocations are going, and that there's a really robust reporting mechanism around it for the future. In the white paper, it talked about the proposals for public health, but clearly some of those have begun. So from the 1st of April, we had the UK, there we go, the UK Health Security Agency, and Dr. Jenny Harries became the Chief Executive Officer. It won't be fully functional until the 1st of October, and until then, Public Health England retains all of its existing health protection operations. But again, we know that's going to change, so it's understanding what will that look like, and I'm sure that, you know, if there are any questions, then Rachel might be able to support any answers around that. So these are the dates that I went through earlier. I apologise if you can't see this particularly. This is more around the development roadmap locally. So this is the information that we have about what has to happen in each quarter between now and April 2022. And then, as I've said earlier, this is the description within the integrated care paper, saying that the integrated care system will, the component parts obviously being the Health and Wellbeing Board, the new Health and Care Partnership Board, and then the new NHS Board when it's created, all of those being underpinned by clinical leadership and hearing the citizen's voice. This one is just the definition of the NHS statutory functions as per the white paper, and it makes it really clear that the NHS board will be responsible for the allocative functions across Cornwall and the Isles of Scilly as far as the NHS is concerned, and that it will be clearly accountable to NHS England for the spend and the resource allocation and the general performance for Cornwall and the Isles of Scilly and the service provision that we give. The Health and Care Partnership is the new board, and we already have a shadow Health and Care Partnership board in the form of the System Leaders Board. So actually, as I said, we've already got some of the building blocks in place. Clearly, it will need to be defined or redefined, and it will need to have a clear terms of reference from a governance perspective, as all of these things will, to be clear about its function. But if you read the white paper, the Health and Care Partnership Board is the collaboration space, the planning across the wider system, and then recommending the best outcomes for our citizens. Health and Wellbeing Board, here we are, and we know that this is a statutory duty and a statutory responsibility, and also the Cornwall and Isles of Scilly provider boards. So people like the Royal Cornwall Hospital and the Community Trust and the CCG in its current format, their statutory boards will still function as they are now as we move towards the new horizon. They will still have statutory functions that they will need to perform. And this is just an overview of kind of where we need to be, but some of the component parts that we already have in place. So we already have our primary care networks who are working really well together. We have our integrated care areas. Now, when I'm talking about working together, that's health and care colleagues. So, you know, we have great teams working together with our area directors for our community trust and our area directors for adult social care, who are doing some great work on the ground close to the local communities. They're a really good example of that cross-working. There are lots of other examples, so that's, you know, this is why I'm saying we must recognise there's a lot of good stuff going on in Cornwall and the Isles of Scilly. We have our integrated care areas that already have boards that are up and running, and they are multidisciplinary teams. So they encompass our voluntary sector colleagues. In some, that needs to be further embedded. Some of our public health colleagues are invited and through them, but that needs to be embedded further. But it is made up of the local providers all coming together with primary care. The new bit, as we've just kind of put here, is the Health and Care Partnership and the NHS ICS body, with the Health and Wellbeing Board kind of running through that, because obviously the Health and Wellbeing Board is responsible for the strategy, it's responsible for the JSNAs, and it's the overarching plan that the integrated care system is going to have to look at when it's planning for its citizens within Cornwall and the Isles of Scilly. So it's critical that they're all connected well and that we have good engagement all the way through, because we do have to make sure it's inclusive. And I think, Chair, that's it from me as an update. I don't want to bore people to death with PowerPoint, so hopefully that will give you a very high level overview of where we're at. I can give an update of conversations and engagement if you'd like me to, Chair.
Thank you, Carolyn. I think that gives us a good overview, and I think then we'll see what questions emerge. I know Leanne said that she'll distribute slides to board members as well, so they're able to see those. Cornelius, did you want to ask a question?
Thank you, Chair. Well, there's two questions really. I mean, I as somebody who spent 6 weeks in St Michael's Hospital in Hale last spring and summer, I conceived a great admiration for the healthcare assistants working there. And what I hope integration is going to mean is that care workers in social care are going to have their skills and training and pay moved in the direction of NHS staff, you know, not the other way around. That's what I would hope. That's a general principle, and I assume that is part of the objective of integration, is to raise those standards in the care sector, generally speaking, to the NHS standards. So that's my first question. The second question is, we talk a lot about integration, and the principle is generally accepted. It's very difficult. It's very difficult to see the integration of health and social care being advanced in Cornwall by the on-off nature of the supposed amalgamation of the two NHS trusts, Partnership Trust and Royal Cornwall Hospitals Trust. So I have to ask, what is going on? Are they going to merge? Aren't they? Surely we need them to merge in terms of the interests of integrating healthcare in Cornwall. So those are my two questions.
Okay, thank you. I can't really make any comments about Royal Cornwall Hospital Trust and the Community Trust because I'm not close enough to whether that's going ahead or it's not. So I'm afraid I'm not going to be able to answer that question for you. As far as the skills and training and pay, that is a common theme of the responses that we're getting. And that's one of the questions that has been asked. Is that what it means? So there is an absolute recognition that that's something that is wanted. Whether that's something that is going to happen, this is where the legislation is going to let us know.
Right. So are you saying that at this moment it's generally considered to be a desired objective that standards, in the social care sector come up to NHS standards, but at this time there's no particular reason there's nothing making that happen?
So there is a recognition that that's the desire, that they should be paid and looked at on an equal footing. But as I say, I don't have any further information about whether that's going to happen, in what mechanism.
Okay, thank you for that. If anybody else wants to comment on the on-off merger between the two trusts, they're very welcome to join in. I think many of us would like to know.
I think from my point of view, Cornelius, is that the merger has been put on hold for the time being. There's clearly a lot going on. Again, I'm not linked directly to either of the two providers, but I think for our purposes today, it's something that potentially might happen in the future, but clearly moving towards the ICS and bringing those areas together, it is going to happen, and it's mandated that the whole of the country will be doing that. But as far as the mergers of the two providers, and I think that's on hold at the moment and won't be going ahead anytime soon.
Okay, thanks.
Okay, Suzanne.
Yes, thank you, Chair. Just really wanted to support Carolyn in terms of her presentation, so thank you, Carolyn. I think it sets out a very clear direction, and we will need to consider, specifically from a health and wellbeing perspective, board perspective, the interface with the ICS as we go forward. That is going to be critical. The other critical point is the adult social care point around the voice of adult social care and the voice that needs to play within that system. I think sort of as we move towards greater integration, and people talk about integration as this word that encompasses everything, but often nobody can define what integration actually means. So I think sort of we need to be very clear in defining what that is as we move forward, and our collaborative arrangements as part of this NHS plan, as we work together with the CCG and the ICS and other partners as we go forward. Obviously, the regulated activity with CQC, we will be receiving more information about that shortly. There is going to be much more focus on data and data collection for providers. That's not just social care providers, but health and social care providers. And because what we have found in relation to the pandemic is often data isn't at our fingertips, or if we do have data, it's not giving us the right insight that we need to look after people well. So that will help us on our journey as well as we move forward. So it's an opportunity now as we move forward to begin to shape this, to begin to shape it as a system, and everybody involvement in that is going to be key, and particularly the Health and Wellbeing Board. So I would encourage this board to be active in those conversations as this progresses. The scale and pace of change is significant, as Carolyn has said. So, you know, getting involved is going to be really important, but it is moving very quickly. And that's because of the timescale of April 2022. And I think sort of not just across adult social care, but across children's services, economy and environment, everything that we do through the Health and Wellbeing Board as well, we need to be mindful that we all play a critical and central part in this. Thank you, Chair.
Thank you, Suzanne. Could I bring in Meredith next, please?
Thank you. So support both Suzanne and Caroline's viewpoint. I think that the Health and Wellbeing Board needs to play a really key role in challenging the ICS around the importance of reducing health inequalities. That's very much what we are focusing on, and it needs to be part of what the integrated care system is focusing on. And I think ensuring that we get that right balance between clinically led, specialist focus, but preventative as well, and that need for us to ensure that we're challenging and supporting that the money is in the right place and resource flows as well to preventative, so that we're over a period of time reducing the escalation of need and reducing the cost in the system as well. And I absolutely agree that that also needs to have really good data and that supports us with our intelligence and our strategic collaboration and strategic commissioning. But I feel, you know, we just need to be making sure that we're getting that message around the preventative agenda and that reduction in health inequalities.
Thank you very much. Any further comments, Carolyn, on any of those?
No, nothing, thank you. As I say, you know, it is about being the Health and Wellbeing Board being engaged and involved, and would really welcome that. Because, you know, it is part of our system and colleagues here are part of our system, so working together is imperative.
Yeah, thank you very much. Any other questions or comments? Clearly this is something from our recommendation is to note the paper and its contents and agree to receive further reports in due course. Clearly there will be you know, plenty more of this over the next 12 months. So, you know, this certainly won't be the last time that we hear from Carolyn as a board. So thank you very much, Carolyn, for your presentation. I know there's a huge amount of work going on, so thank you for that. Can I just check, Leanne, do we need to take a vote on the recommendation about noting the paper?
Yeah, we do, because we're agreeing to receive further reports. And also I know that the board in the past have, in the development workshops, have looked at some of this, and it is intended that, subject to funding, the LGA development work that we've been part of might be able to help with the ICS involvement and maybe do some collaborative engagement in some of those spaces as well. Okay. I'll need a proposer and a seconder, Chairman.
Okay, can we have a proposer and a seconder, please, just for that recommendation, and then we'll take the roll call.
Propose.
Thank you, Rob. Rochelle will propose. Got nobody coming forward quickly, so I'm happy to second from the chair. And Leanne, would you be happy to take the roll call vote, please?
Thank you, will do. So, as per all of the others, 4 against or abstain. Chris Blong.
4.
Helen Boardman.
4.
Natalie Jones.
4.
Paul Cook.
4.
Councillor Sally Hawken.
4.
Emma Alden.
4.
Cornelius Olivier.
4.
Adam Painter.
4.
Miles Topham.
4.
Councillor Rob Rochell.
4.
Meredith Teasdale.
4.
Councillor Mike Thomas.
4.
Rachel Wigglesworth.
4.
Jodie Wilson.
4.
Suzanne Wixie.
4.
All in favour, Chairman.
Thank you very much. That's unanimously carried. Thank you, Carolyn, for your update, and I'm sure we'll see you again soon. Thank you.
Thank you all. Thank you. Bye-bye.
Thank you. Bye.
Thank you.
So we are now at the end of the agenda, as far as I don't have any other business as far as anything that is considered to be of urgency, but I would just like to make a few remarks just on closing, obviously, this meeting, as well as obviously this session of meetings for the last 4 years. So just a few notes that I had just to say before we do close for the day. But since 2017, the board has overseen and guided the development of a new JSNA and health and wellbeing strategy, and as a result determined its board focus on inequalities. The recognition that the well-being of a person is far more than simply just health, and that all partners have a role and a voice to ensure that that message is heard. The wider landscape has changed significantly. 4 years ago, the focus was on shaping our future, and we continue to look at the long-term visions and plans for the health and well-being of residents of Cornwall. The creation of the new ICS, which we've just been hearing about, and the part the board will play in that will be crucial. As part of its work, the board has considered a wide range of topics: the pharmaceutical needs assessment, healthy weight, physical activity, smoking, mental health, fuel poverty, warm homes, homelessness, rough sleeping, and it's continued to have its oversight of the Better Care Fund. So the board's been on its own development journey as well, working towards specifying its own unique role in a vast spectrum of partnerships, committees and structures. And the engagement by more board members in the work being undertaken by the Local Government Association has been demonstrative of the will to make sure that this collective work together, using its position and the role of the board to make sure that that works, and I hope that certainly this work can continue and opportunities are grasped going forward. Dr. Ian Charlton stepped down from being chairman of NHS Kerno and vice chairman of the board recently. I'd like to place on record my thanks for Ian's help and being vice chairman for the last 4 years. He's put a huge amount of support into this board, chairing it on a number of occasions. And I'd just like to thank Ian more widely for the amount of work he's done for Cornwall as a whole, both as a GP and his work across various different bodies across Cornwall's health and care sector. So I know the board will likely have a slightly different makeup at its next meeting, but for myself as chairman, I'd like to thank all members very much indeed for your contributions and the work you've done over the last 4 years, and I look forward to seeing what the board does over the next 4 years. So thank you all very much indeed. Thank you for your patience and endeavours, and have a good rest of your day. Thank you very much.
Thanks, Adam.
Thank you.
Thank you.
Thank you.
Thank you, Chair.
Thank you.